keep your volume down. Yeah, there it is.
I'll be wearing headphones because someone will bleed through it.
Yeah. Okay, hey guys, this little test stream on YouTube Live, which is new for me. I'm going to talk about we're going to talk about probiotics today and how it could be helpful for your pregnancy. And then also maybe when we're done, we'll take some questions if you guys have questions. So hi, good afternoon, Saturday, kind of a snowy, crummy day out there, not enough to really go skiing. So we're here trying out a test live stream. So basically I want to talk to you about, could probiotics be helpful for the health of you or your baby? It's not a loud chair at all. We'll discuss this topic live, and then we'll see what questions you have. So first off, I'm going to explain what probiotics are, and then I'll talk to you about some of the research that gets into what the potential benefits might be for you or your baby. So, first off, probiotics are bacteria that are present in certain foods like yogurt and other fermented dairy products like kefir, and also in fermented drinks. I'm drinking a kombucha today. I don't know if you can see that or not, but there's a kombucha. And other fermented foods, probably like kimchi. You can also get them in supplements, and the two most common supplements that you can get are lactobacillus, that's a hard one to say, and bifidobacterium. So those are the two most common. I'm just looking at my notes here. So just to tell you a little bit about that, so the idea is that in your gut there are just millions of bacteria living, and the bacteria are actually really important to good health. And it turns out that these microorganisms that colonize the gut may play a big role in certain disease processes, for example, diabetes, possibly preeclampsia in pregnancy. Just to talk about some of that for a minute, just to tell you some of the research that I came up with on this. So first off, type 2 diabetes has been associated with changes in the gut microbiome. And obese women have been shown to have different types of bacteria in their gut from lean women. Acidophilus supplements have been shown to reduce, to actually aid in weight loss in women who are overweight, and also reduce their risk of developing diabetes and improve glucose control in diabetes. It's also been shown to be helpful in pregnant women who have gestational diabetes. And then another study showed a reduction of risk of preeclampsia in moms who use a probiotic supplement. So then I looked at a big systematic review, meta-analysis that looked at the effect of treatment on gestational diabetes. And it showed that there were, let me read all these to you, significantly reduced what we call fetal macrosomia, so large babies, difficult births, shoulder dystocias, and also associated gestational hypertension, and also potential tendency of reduction towards birth injuries and things like that. So really important to mention that probiotics are considered safe to use in pregnancy. There's a fair amount of data out there to back that up. And if you think about one simple thing, like one source of a ton of probiotics is a live active culture yogurt. And it turns out that it's something in the neighborhood of, what I say, 50 billion colony forming units are in one serving of yogurt. And the dose that was studied specifically in pregnancy was about 10 billion colony forming units. So if you figure, well, you can eat one thing of yogurt a day, I don't think that's going to cause any harm to the baby. But the interesting thing is that it certainly could give you a lot of benefits. So a quick Amazon search of some supplements found that the typical dose was about 10 billion. So one of those a day would be good. And then also, like I was saying, with yogurt, it's really variable. It depends on the brand. It depends on the type. And it probably also depends on the serving size. And but definitely like one a day of that and you're probably good. So that is just a bit of information that I found really interesting. There's a huge study that's going on right now that's a really big Cochrane database review that's going to look at this in more detail. So I don't know when that's going to be published, but it's really exciting. And Yeah, I'm live. My wife's walking by, whispering in my son's ear, he's live. So, yeah, so that's kind of the gist of it. Hopefully you guys find that useful information. It is an interesting idea that you could possibly just take a probiotic supplement every day and reduce your risk of gestational diabetes and preeclampsia. There's also some other studies I've mentioned in other videos looking at things like food allergies that could be related to that, as well as a fish oil supplement. So I definitely think it's worth probably everybody trying. I don't really see any harm in something as simple as one supplement a day of a probiotic or one serving of yogurt a day. So I don't see any downside to that, really. I guess if you're lactose intolerant, that could be a problem, but you could just take it as a supplement. So if you guys have any questions for anybody that's out there watching, feel free to jump in. Not just necessarily about this topic. I'm really just testing out this live stream. If you are watching, thanks, Dee Dee, for saying hi. Good afternoon to you too. Hope things are going well for you. I know we've chatted a few times back and forth in the comments. I think the latest I remember was you're scheduled for a C-section, but not for a while, sometime next month, I think. So hope everything's going well for you still. But yeah, if you guys have any questions about the probiotic stuff or anything else, really, now's a great time. If you can hear me, even just put a comment like, how does this sound? I've got a new setup here with a different streaming software and a new microphone here. So I'm curious to see how it sounds on the side where you guys are and wherever you are. And let me know where you're watching from. If you're out there watching, that'd be great, just to kind of see how far out there we're reaching. Yeah. So I'm just talking to my son over here in the corner who's monitoring as a moderator for me. He's staying really busy right now. So how's it sound over there, Coop? Can you hear it? It sounds good. You can hear it clean. Good. Good. Oh, take the probiotics daily and fish oil daily. Yeah, that's great. I think it's probably a really good idea. It's not something that I've really focused on in the past, but there's a lot of emerging information out there that it really could be helpful. So I think it's a great idea. And this is, I don't know if you can see this or not. This is one of the kombuchas that I like, the Gingerade. I find this one to be pretty tasty. Some of them are kind of nasty, but I've liked this brand pretty good. So if anybody else out there watching, if you have any questions or anything, I'm just going to see. Yeah, it looks like everything's working fine. Magnesium citrate for blood pressure. Yeah, I don't know of any data on that specifically. There's tons of research on trying to prevent preeclampsia, and a lot of mixed results. They tried calcium supplementation. I'm not aware of any magnesium supplementation studies, but kind of not great overall evidence. I don't think there's any harm. I have on occasion recommended magnesium supplements for folks with leg cramps. That sometimes seems to help. I definitely don't think it's causing any harm. There's pretty good data on low-dose aspirin, so 81 milligrams a day. If you have a history of hypertension in pregnancy or preeclampsia, that probably reduces the risk a little bit. So definitely recommend that for sure. I'm just looking around the camera here to try to read the comments. So yeah, if you guys have any other comments, feel free to jump in. I'm just kind of babbling at this point to see if this works and see if anybody has any questions today. I don't know who else is out there watching. If you don't mind, put a little comment in there. Where are you watching us from? Okay, here's a question for you. Who's your team for the March Madness? My team already lost, NC State. Every year they give me hope that they're going to do well, and then they typically lose in the first or second round. So my team's out. My son's pulling for Duke. He's always been a Duke fan, which is really painful for me as an NC State fan. But it was it was a team that he got hooked on thanks to his grandfather, who they used to spend a lot of time watching those games together. So can't hold it against him there. No one's saying where they're. Maybe there's probably a delay. I think there's a. Yeah, I'm not sure exactly how long it is. It's probably
It's like 30 seconds.
20, 30 seconds is what Cooper's telling me between when when I say it here and then when it actually comes out in the speaker. So you guys may only now be hearing me talking about March Madness. Oh, hey, Leslie, out here in California. Video sounds great. Thank you. How do you feel about the midwife's brew for labor induction? You know, honestly, I don't know. Let's see what you say is in there. Lemon, verbena tea, apricot nectar, almond butter, and castor oil. Well, I'll tell you, castor oil, the thing about castor oil, it can lead to some pretty nasty diarrhea. And I've seen it in action, and it's not pleasant. So if you do it, if you do it, watch out. I don't think there's anything dangerous in that brew, so I don't really have a problem with that per se. But like I was saying, I've seen the after effects, and it's not pretty. I think that it may be the mechanism of action it may be through dehydration, because you have such bad diarrhea. I think you can get dehydrated, and as a result, it may give you some contractions. There may be other mechanisms, but for the most part, castor oil is really not absorbed into your gut. That's why it's such a powerful laxative. It sort of basically pulls water into your colon and makes for this just very watery diarrhea. So watch out. The almond butter is supposed to help prevent diarrhea. Interesting. I've not heard of this particular brew. If you try it, Leslie, let me know how it goes. Okay. Let's see. Haley says, what are the chances of breastfeeding after breast augmentation? You know, the short answer is it depends. I've definitely seen people have success, but a lot varies depending on the type of surgery that you had. And the most important thing is if the area around the areola, so right around the nipple, if that's been disrupted by the surgery, then you pretty much it's probably not going to happen, because of course the milk comes through those little ducts and they ultimately feed out to the nipple. So, you know, if there's been an incision around that could disrupt that plumbing basically, and it's not going to work. Now, if you have, you know, pectoral implants where they make an incision kind of down low and just put the implant up, that's kind of up into the chest wall. I've seen pretty good success with those people breastfeeding. So a lot depends on where your incisions were made and whether or not the areolar area was disturbed. But I definitely would encourage you to give it a try. You know, even if you've had that surgery in the areolar area, you know, it's not wrong to try. The worst case scenario is it just won't work. So I don't think you're causing any harm. Let's see. Well, thanks, Dee, for putting in the comments, and Haley and Leslie. So we got Texas, we got California. That's awesome. So yeah, just if you guys have questions, put them in. I'll ramble on for a minute. I know Dee and I have kind of talked back and forth about this whole VBAC thing. I guess in some parts of the country, it's still a big issue. I really didn't realize that there were parts of the country that were having such a hard time having doctors that were willing to do trials of labor after C-section. Hey, Pleasant View. Hey, Haley. So it's I guess surprising, not surprising that that's an issue. I mean, I think at the end of the day, it's been a medical legal issue. Unfortunately, you know, if something bad happens, then you pretty well can count on a lawsuit happening. And, you know, they're traumatic for everyone involved, most importantly the patient, but even for the doctors. And then your malpractice insurance goes up, and, you know, kind of around and around it goes. Fortunately, you know, I've had a lot of really great success stories with VBACs. You know, anybody who's done VBACs for any period of time will see a complication, you know, rarely. But it's been, knock on wood, many years since I've had any problems. And I think that the Maternal Fetal Medicine Units Network predictor tool, which is on my VBAC video, it gives you a good idea of what your chances of success are. And when you plug in those numbers, you know, if you can get about 60% or better, my experience has been things go well. It doesn't mean you're always going to get a vaginal delivery out of it. But, you know, my experience, things tend to go well. So I don't know, in other areas, I don't know what it's like in California as far as VBACs go. Can you tell him to come in and quit barking? So if you can hear one of my goofball dogs out there, Buddy, the big goofy golden retriever barking at somebody, probably a leaf or a snowflake if I had to guess. It's snowing here in Utah today. Not really enough to go skiing, but enough to ruin the outdoor run I was planning on for today. So had to do a treadmill run. That was kind of a drag. So I'm just going to reach around here and scroll up and see if I see any other questions I've missed. Oh yeah, have I ever seen an accidental breech birth? Oh yeah, happens. It happens not infrequently, and you know, the funny thing is that when I was a resident, we did breech vaginal deliveries all the time, and it was actually pretty rare to do a C-section for a breech baby, you know, given the right circumstances. So mostly we're talking about full term. We're talking about spontaneous labor, babies that don't have any kind of weird anomalies in their head or anything strange, you know, a normal-sized mom and a normal-sized baby. And, you know, honestly, never really had any problems. We delivered breech babies all the time and would encourage folks to do it. And then in about 2000, a study was published out of Canada. I think it was the New England Journal of Medicine, that compared what you call intentional trial of labor or intentional vaginal breech versus planned scheduled C-section. And there was a slight increased risk to babies where the trial of labor was undertaken. It wasn't anything major, but it was enough. Excuse me. It was enough that it kind of put the nail in the coffin in the U.S. Excuse me, guys. Sorry. I don't know what the what it's like in Canada after that study. I suspect they probably still do more vaginal breaches than we do. But an intentional vaginal breach nowadays is fairly rare, but an unintentional, or like you said, accidental vaginal breach, it still happens. And actually, you know, honestly, most of the time I'm like, great. I mean, if you're going to be breaching, be in labor, just come in having a baby, because it makes it pretty easy. We just go for it. Now, I would never tell anybody to stay at home and labor at home for hours and hours, but I'm just saying, you know, if you had to pick between the two, someone rolls in with a baby coming out, I'm just going to deliver it and not try to rush them back for a C-section. Because I think at that point, it'd be more dangerous to try the C-section, honestly, because it can be difficult to get the baby out if they're kind of halfway coming out the other end. So, yeah, I've seen it. I do it. And it's always exciting for everyone involved. But honestly, most of the time it goes fine. I just delivered a vaginal breech about a week ago that was a second twin. So that's called a breech extraction. So the first baby was coming out head down, and then the second one was coming out feet first. So I just reached up there and pulled them out by their feet. It went great. Everything was good. Mom avoided a C-section, and both babies did real well. So I'm all for it. It's just kind of unfortunate. You know, a lot of times the climate we're in, the medical legal stuff dominates the medical decisions. And fortunately, here in Utah, it's not as bad as a lot of places. I mean, no matter what, those kind of things happen. Somebody, you know, bad things happen, and unfortunately, lawyers often get involved. But it seems to be less of an issue here than in some places, thankfully, which makes me really happy to practice here in Utah. And also, the other nice thing is that people have a lot of babies here, so we have pretty high volume and see things that other people wouldn't see on a regular basis, just because we have so many deliveries. All right, I'm just gonna reach around here and scroll up. Looks like I'm caught up with everybody's comments. So yeah, well, still got people watching out there. So thanks for continuing to watch. If anybody has anything they want to talk about, throw a question in the comments. I will just kind of pause here for a second and look through my little list of ideas for things to talk to you guys about while we're waiting. There was the other one I was talking about was food allergies. It's a relatively new video up on my channel that looked at supplementation with fish oil and also the probiotic supplements. So that's one to look at. Leslie asks, how do you feel about laughing gas making a comeback? Yeah, it's interesting. We haven't seen a ton of it here in Utah. I don't know what it's like in other parts of the country, but say, for example, in the United Kingdom, they use it a lot. And there's plenty of evidence that shows that it's safe and it's effective. And they have these systems where the mom can actually deliver the medicine to herself. It's basically a mask that they put up over their face, and it only delivers the medicine when they're pressing it up to their face. As soon as you kind of relax, the medicine flow turns off. So you can't really overdose yourself, because as soon as you get a little drowsy, you take it away. And it quits delivering medicine. So I think it's great. I think there's good evidence that it's safe, it's effective. So I think it's interesting. I don't know that we'll see much of a comeback here where I practice. There's a very high epidural rate. which in all honesty, I don't think is a bad thing. I'm all for people trying for natural birth, but I'm also okay with people being comfortable if that's their choice. And the anesthesiologists here, kind of like us, they do this every day, all day. So they're really good at dosing epidurals lightly and not impairing people's motor functions so much. I mean, you still sometimes get somebody that gets really numb, but more times than not, they have closer to what you'd call a walking epidural. So I don't know that in this area you'll see a whole lot of the laughing gas thing. But if somebody wanted to try it, I wouldn't think that it was wrong. I think the main problem in our area would be we don't really have the equipment to deliver the medicine the way I was telling you about, where it's kind of this patient-administered deal. But I think overall it's a great idea. It's a good question. So let's see. If you guys have other questions, jump in, please. I'm just looking back through my videos to see if I have any other things that have come up recently that are worth talking about. Oh, and Leslie, I think I thought of one other thing about pain relief. So there's a video that's a little bit further back in my channel that looks at this idea of water immersion as an option for pain relief. So basically getting in the tub when you're in early labor. And so water immersion during the first stage of labor. So prior to actually pushing and having the baby come out, but up until then, up until say 10 centimeters, using the tub kind of as needed for relief of pain. That's been shown to reduce epidural rates. So if you have somebody who doesn't have the option for laughing gas, but wants to try to reduce their chances of needing an epidural, then this water immersion in the first stage of labor is a good thing. So far, no one is really promoting, no one, when I say no one, I mean no one from, say, our college, the American College of OB, is promoting water birth, so actually delivering the baby into the water, for a couple of reasons. One of which is the obvious, which is if you're born underwater and you take a deep breath, there is some risk of drownings, and those have been reported, and it sounds dramatic, and I'm sure it's not very common, but gosh, if it happens, it's a tragedy, and it could have been prevented, so I don't think you'll find anybody promoting that. And the other one is potential for infection, and of course that has everything to do with how that tub is maintained. But what you're talking about is a big tub of water, and if it's not warm enough, then it can lead to some issues with infection. There have been some reported infections in moms who actually delivered into the water, and it's probably because, especially like jetted tubs where the water's kind of fluffing around everywhere, there's probably, if there are bacteria contaminating that water, then that's an aerosol, and this infection is spread by breathing it in. It can cause like a pneumonia type deal. So that's a Legionella type infection. And so, I don't think you'll see that, but as far as the first stage of labor goes, I think it's perfectly reasonable. At both the hospitals I work at, we have good facilities for that. One of them actually has this giant tub they kind of roll, and it's really nice. And use in that situation. And the other place, they just have kind of tubs in each room that are not as big and fancy, but still get the job done. So I think that's a good option too. But thanks, that's a great question. Let's see. If anybody else has questions, jump in. I'm just going to kind of roll through here and see if I have anything else smart to say. Oh, another one, just kind of in that whole VBAC discussion, is this whole idea of vaginal birth after 2 C-sections. And I know that's even a harder sell if you're in a place where they're not sporting after 1 C-section, but our college recently put out a sort of an update to the publication on vaginal birth after C-section, and they actually say we should not discourage someone from trying after 2 C-sections. The data would indicate, the risk, that the risk is really not that much increased over 1. Maybe it goes from a 1% risk of a uterine rupture to a 2% risk, so not a huge increased risk, and obvious benefits of the vaginal birth. So. That's something that, if I have a patient that's the right candidate, I'm certainly open to and have had some success with. So I think that's perfectly fine. But like I was saying, if you have a place that won't let you do it after 1, they're probably not going to let you do it after 2. And then kind of on that same idea, like, how long should you wait to try to conceive again after C-section? It's really pretty much the same for a mom who had a vaginal birth. So if you nurse for that first year of postpartum, typically it's going to suppress ovulation pretty well, and so as a result, you probably won't get pregnant while you're nursing. And so if you nursed for about a year, then you're looking at almost 2 years between your deliveries, and that's probably a good number. If you look at the VBAC question, if you deliver less than 2 years between deliveries as opposed to more than 2 years between deliveries, a little higher risk of uterine rupture. But again, it's kind of like the 2 C-section thing. It's about maybe double the risk. So you're still only talking, maybe a 2% risk. So not a huge thing. So yeah. So hey, welcome. If you're just jumping on, Wes Davis here. I'm with Circle of Life in Ogden, and I was just doing a little test live stream, but some folks started jumping on, so I'm answering questions, which is the thing I'm always happy to do. It's really fun. I love the interaction. If you're jumping on now and you have a question, feel free to put it in the comments, and we'll chat. Otherwise, I've just mentioned to you real quick. If you're here, you're probably well aware I have a YouTube channel. There is a video on there. Gosh, I'm looking back. It's months ago now. I'm actually still trying to give away this Vitamix smoothie maker, but I'm gonna give it away when I hit 1,000 subscribers, which I'm actually getting a little closer to. So if you haven't subscribed already, maybe think about subscribing and then put a comment on that video, and that's how you enter for a chance to win. And the minute I hit 1,000 subscribers, we're gonna do the drawing. We're getting closer, so maybe in a couple more months. So I'm not really, here we go. Test. Sarah, hey, I see your test. So I see your comment. If you have a question, fire away. Well, not really seeing. Oh, here we go. What could be the reasons for breech in same woman, different births? It's a good question. The first question is, how is it that 95% of babies figure out that they need to be head down by 35 to 36 weeks? And that's a mystery. Does it have something to do with gravity? Does it have something to do with the head is the biggest part and that's kind of lopsided and tends to go down? We really don't know. So some theories are about the baby, and then some theories are about the mom. Obviously, if you have more than one baby coming out of breech, makes you think more that something's going on in terms of maybe the shape of the pelvis that's making the baby so it's harder to flip around or something like that. But honest answers, we really don't know. It's a mystery, and it's actually one of the big mysteries to me, like what starts labor, how do babies know to get turned head down? Those are two, just when you think about it, pretty crazy ideas that we just have no idea about. So it's a good question. I wish I had a better answer. Oh, hey, for you guys that are out there in other parts of the country, are you getting much feedback from or much information from your docs about doing the Tdap shot, so vaccination to reduce babies' risk of whooping cough? I'd be curious to know. Here in Utah, we've had a pretty bad outbreak. We've been pushing really hard to try to get as many moms vaccinated as possible. There's evidence that you can reduce the risk of neonatal pertussis by giving the mom the Tdap shot. So that's a big thing here. I'm just curious if it's a big thing anywhere else. So yeah, Dee Dee said her babies are confused or she has issues. Yeah, I'm not sure. Like I said, it's a mystery. Not really sure what that's about. So Dee Dee, I think you're talking about pertussis. You said grandparents can be carriers. Yeah, and the flu shot also a really good idea. Plenty of evidence that risk of the baby getting the flu is directly related to how many folks around that baby have been vaccinated. And so I'm the same. We definitely encourage our patients to get the flu shot. But Dee Dee's question was about basically, should other people around the baby make sure they're up to date on the Tdap? And my answer is yes. Excuse me. My answer is yeah. So, there's plenty of reason to think that if you have more than about 5 years since you had your Tdap shot, you're not immune anymore. And although the guidelines officially say 10 years, there's data, I've seen the research that shows at 5 years, the vast majority of folks have no detectable immunity. So I actually do encourage like dads and grandmas and folks like that, if they haven't had one in the last 5 years, I'd ask them to get one for sure. I've gotten some family docs in the area kind of pushing back again because of the 10-year recommendation. I think they're probably just folks that don't take care of newborns or don't take care of pregnant moms and understand that this is a special situation, and we really just want to protect the baby. In an adult, if you get the whooping cough, it's unpleasant and you don't want it, and it's really not fun. But in a newborn, it can be life-threatening. So really want to do everything we can to help protect the babies. And so the most important thing, of course, is mom gets the shot around 28, 30 weeks, somewhere in that third trimester. It takes a couple weeks to a month or so to really get your immunity going. So we recommend doing it around that 28, 30 weeks. But at least sometime during pregnancy, that's ideal. And even if you had the vaccine, say, a year before you got pregnant, we recommend get another one. So you're still immune, but the baby's really not going to benefit much. It's when you initially get that vaccine that the antibodies really rise and cross the placenta. So that's why I recommend every pregnancy. And Dee Dee's question is, what about her kids? So the kids are on a vaccine schedule. So, assuming your kids are getting their shots kind of according to the schedule, then they're still getting them. So this really only applies to adults. So typically kids are fine. Also, I'll just mention while we're just waiting. Oh, you're welcome. We're waiting to see if any other questions roll in. So I've got my son over here doing the moderating. He's really not having to do anything, which is great. I tried this before, and I think I must have had like an attack of 12-year-old kids starting to spam my feed. I really hope that doesn't happen. But we've been going 30 minutes, and so far I haven't seen it. I did also install a bot on my YouTube channel to do some of that moderating behind the scenes. So far, it seems to be working. I'm really glad, because it becomes a pain when you're sitting here trying to strike down people who are just saying silly things and distracting from the conversation. So far, so good. Well, if anybody else has a question, I'll be happy to answer. I think otherwise we'll wrap this up here in a couple minutes. Thanks again to everyone who's watched today. It's been fun. And hopefully you can hear me well and see me well, and that's all nice and clear. I've tried really hard to get better camera gear. It's been interesting. It's been an interesting little journey through the technological side of this to figure out what actually works and what doesn't work. And every little step, it seems like I get something working and something else breaks. But I think I've got everything working now. So hopefully you guys are getting a good video and audio signal. Well, I'm not really seeing any other comments popping up, so thanks again to everybody who's watched. I think we'll call it good here. Hey, stay tuned. If you like these, you can turn that notification bell on. Apparently, on the if you subscribe to my channel, there's also like a little bell you hit, and that gives you some kind of notification if I go live. I like doing these. I like the interactive nature of it. They're actually more fun than, I enjoy making the videos. They're fun, but this is actually more sort of spontaneous and can kind of just really hit on what people want to hear about. So keep an eye out for those in the future. I do them also on our Practices Facebook channel. Our practice is called Circle of Life Women's Center. So you can find that there, and the same kind of thing. I think you can get notifications if you want them that we're going live. So, hey, thanks everybody one last time for watching. Thanks for your questions. Really appreciate it. And I hope everybody has a great weekend. I think we'll call it good right there. So everybody take care. Have a good day. Bye.